Dr. G. Today we have a couple of questions that people are asking. Who qualifies for an implant?
Well, anybody who's lost a tooth for many reasons, who is uncomfortable and who wants to get a replacement, who wants to be able to eat and smile confidently will qualify. To the most part, most people will qualify for an implant.
What are some of the factors that affect?
Some of the factors that affect implant placement / restoration are: do we have enough bone? That would be the step one we check. Do we have enough bone? Do we have enough space? So let's say, for example, if you're missing a single tooth, do we have enough space between those two teeth to have a proper looking implant? So the factors are: do we have enough bone? Do we have enough space? Is the patient healthy? Their gum healthy and all that? And then overall, the patient's overall health as well.
Can teenagers get implants?
Usually, we do implants on teenagers when they're done growing. So I would say, when they're still growing and they're early teenagers, they don't. We wait until they're, for females, usually up to age 19, and for males, probably age 21. When they're done growing, they can get implants done.
Does a perio patient, is a perio patient eligible for implants?
That's a really good question. So perio patient, in other words, for patients that don't know what perio patient means, somebody who's got gum disease. Okay, so normally the gum disease is your number one reason why people lose teeth in the first place. Okay, so what that means is the perio needs to be treated first. They got to get healthy, gum needs to be healthy. And so, gum disease is not reversible, but we can stabilize it. Once the patient is stabilized and we have a protocol to a point where, once they're stable, yes, they can get implants. But until they get stable, the same reason you lose teeth, you can also lose implants. So that's why I make sure that the patient is periodontally healthy. So.
Can I come in and get an implant placed the day of? Or is there planning?
Very good question. Back in the days, doctors, they just go ahead and place implants wherever it is. Nowadays, the protocol is just slightly different. We want to make sure that we call that prosthetically driven implant, which means that we need to know where the crown, how aesthetic is going to be, which means that we have to plan it. I wouldn't, for example, for me as a patient, I wouldn't have an implant just put it in whatever there is bone, like back in the day. So nowadays, we really like to plan it, visualize where the implant is going to be before we put the implant in. So yes, there is some planning involved.
Okay.
So,
are all implants the same size?
good question. And frankly, so that's part of the determining we do with the CBCT or 3D scanning, is to make sure what we're working with. And so depending on how much bone we have, how much width we have, and we pick, where the nerve is. So for example, here you can see I have an implant. Implants can go from anywhere from 8 millimeter to anywhere to 16 millimeters. So depending on the condition, and so they come in different sizes, different diameters, different length, and all that. Everything is selected based on your clinical finding. And so if a patient needs a longer implant, we do a longer implant. If they don't really have a lot of bone, and if we're okay to stick in a smaller, shorter implants, we can do that. So there's no real one solution for everybody.
All right.
What other question do you have?
Price range.
Good one. Actually, it's the worst thing you can do is just ask for a price range over the phone without really looking at the big picture. So typically for us, we want to visualize the outcome before it happens. And so, do we need grafting? Do we need surgical stuff? Do we need this? There's so many multiple factors. Is the front tooth? Is the back tooth? Everything has a factor on determining the pricing. And so I would never actually say that this is the price on an implant. It's a case by case. So
Yeah.
any other questions?
No, I think that sums it all up.
Awesome.
Thank you so much for your time.
Thank you.